Part 2, the ARTC approach to repairing joint pain and damage. This presentation was prepared by Dr. Max McLeod, DO, MD, PhD. Doc Max is also known as the Nutrition Ninja Doc. He's devoted over 5 decades to studying health and health optimization while being in clinical practice since 1979. He has 3 postgraduate degrees in the health sciences and is a contrarian, always looking for better ways to help people overcome their health challenges and achieve their health goals. He has been doing regenerative injection therapy since 1993 and has added human tissue products including stem cells, growth factors, collagens and cell signaling molecules over the past several years. Additional details about regenerative injection therapy, RIT. The basic RIT technique is also called prolotherapy due to its ability to stimulate the proliferation and regeneration of connective tissue by attracting and activating fibroblasts. The technique involves carefully injecting small amounts of a mild irritant solution at specific locations called the emphasis. These sites are where either ligaments or tendons connect to the bones depending on which structure is being targeted. This is the site where injury occurs in most situations as previously stated. This technique stimulates the chemical messenger system of the body, cytokines, to attract and activate a special type of cell called fibroblasts. Fibroblasts, once activated, will produce and lay down new collagen and elastin proteins that strengthen the damaged connections. Regenerative injection therapy is simply a technique that tricks your body into thinking there is a fresh injury, thereby mobilizing, activating, and enhancing your body's natural healing response. There are typically a series of treatments spaced 1 to 3 weeks apart, allowing a gradual ramping up and buildup of new connective tissue to restore the original strength to the area. Remember what we talked about earlier regarding tendons and ligaments having a very slow turnover and replication cycle? By tricking the body into thinking that there's a new injury, the turnover and replication cycle are dramatically increased. Regenerative injection therapy, RIT, can be used to help restore strength and integrity to virtually any joint in the body as long as the injections are properly placed and the person is able to mount a solid repair response. For maximum benefit, it is important for the person to be well nourished, including proper supplementation, along with good circulation to the area. That's why we recommend our Foundation Nutritional Support Program to those undergoing RIT. RIT stimulates the healing response and proper nutrition supports it. There have been over 150 studies published on the efficacy of basic RIT, aka prolotherapy. The first study was published in 1937. These studies consistently show an 87-95% success rate at improving joint stability, reducing pain, and restoring proper function. The tragedy is that so few doctors know about it and even fewer are proficient at it. It should be the primary tool used by orthopedic surgeons. However, most are not interested as insurance pays big bucks for surgery and that's what they spent several years and over $100,000 learning to do. Sadly, Medicare, being the illogical, brainless behemoth that it is, has chosen not to pay for RIT since it is regenerative. For some bizarre reason, they do not consider anything that is regenerative to be medically necessary, although they will pay for a joint replacement once the situation is allowed to progress to that point. Prevention and regeneration do not seem to be concepts that this agency understands. Of course, all the big insurance companies follow Medicare's lead and do not pay for RIT and other regenerative treatments either since Medicare won't. As ludicrous as that sounds, it is the reality of our current, hopelessly misguided, largely corrupt, and inefficient disease care system. More bad news about RIT is that very few doctors are properly trained in this technique. To do it right and get the full benefits, it requires precise placement of regenerative solutions at all of the key tendon and ligament attachment sites in addition to into the joint itself. Since 90+% of all doctors doing RIT with PRP and stem cells have zero training in musculoskeletal medicine or the basic RIT technique called prolotherapy, they simply do not put the solution everywhere it needs to go. Please take this into consideration if you go shopping for the best price for PRP or stem cells. More on those 2 topics to follow. The good news is that the procedure is very cost-effective, and most importantly, it just works. There is a tremendous amount of material about this technique online, so by all means do your homework. Most of it is under the term prolotherapy. Also note that our approach is quite comprehensive as we incorporate several other components to maximize your results. In the vast majority of cases, 4 to 6 sessions will do the job nicely. More severe or chronic damage may take 8 to 10 sessions, but that is only when the damage is very severe, has been there for decades, and the individual has a reduced healing capacity. In those cases, we recommend using some stronger solutions. Most people have heard about PRP, platelet-rich plasma, injections as well as stem cell injections. Basic RIT, aka prolotherapy, is the predecessor of these techniques. These two simply use different, stronger regenerative solutions as irritants and proliferants. In many cases, basic RIT will work quite well, although it definitely takes longer than if the stronger solutions are used. There are definitely cases and situations where it is both reasonable and quite desirable to use one of these stronger biological agents to magnify and speed the regenerative process. If the damage to the underlying joint and connective tissues is extensive or if the individual is not able to mount a solid healing or regenerative response, those are times to pull out the big guns and add either what we refer to as beyond PRP or stem cells to the proliferant solution. PRP is typically taken from the patient's blood after processing it to concentrate the growth factors and collagens. The problem is that as we age, the blood has less and less growth factors and collagens. So, although basic PRP may work really well in a 20-something athlete, its success rate plummets when dealing with 50-plus-year-old blood. PRP is also quite pricey due to the time involved in the use of special processing supplies. For those reasons, we prefer to use growth factors, collagens, and cell signaling molecules from the amnion, which is the strong layer of tissue that envelopes the umbilical cord. It contains 10 to 20 times the number of growth factors and collagens as even a healthy 21-year-old's blood at about half the price. When there is significant joint degeneration or the person is over 60, the best approach is to pull out the big guns, mainly stem cells, although Beyond PRP may also do the job. Many doctors are still using stem cells derived from the patient's bone marrow, although the research does not support that being the best source. Instead, we use very young stem cells from Wharton's jelly in the umbilical cord. This is not fetal or embryonic tissue, it is the afterbirth product from full-term, healthy, C-section deliveries. The women who donate the afterbirth tissues are carefully screened and verified to be free of any and all chronic and infectious diseases. The tissues are processed, filtered, concentrated, and tested for over 24 pathogens before being accepted for use. These stem cells average between 4 to 7 months old. How well do you think they will work compared to the stem cells from someone that is 60 plus? I categorize the different levels of RIT based on the degree of damage and the solutions needed as follows. RIT level 1 uses the basic solution consisting of fairly mild pharmaceutical-grade irritants. This has been used for several decades quite successfully. It provides consistent, predictable results and is extremely safe. RIT level 2 adds Beyond PRP and/or exosomes for their strong concentration of growth factors, cell signaling molecules, and collagens to boost the overall response. Exosomes are extracellular vesicles that contain large amounts of a wide array of growth factors, nutrients, and cell signaling molecules. All cells produce exosomes, including stem cells. Some researchers believe that the exosomes may be the primary driver of the repair process. RIT level 3 uses both Beyond PRP, exosomes, and stem cells for maximum healing and regeneration in the least amount of time. All three are done along with our Wolverine healing protocol to activate a person's healing superpowers. As you likely suspect, the cost increases as stronger solutions are added. Sessions can be done individually or as a package. Our approach is based on 30 years of doing regenerative injection therapies and around 45 years of clinical experience overall. What I've learned is that the idea of a one-and-done approach rarely, if ever, works as well as a series of sessions. The optimum number of sessions ranges between 4 to 6, although people typically feel significantly better after 2 to 3. From this experience, I've developed a protocol that works great for 95+% of people while providing the best value. Whether it is level 1, 2, or 3, the same rule applies. Pay for 4 sessions and receive up to 7 treatments. My goal is to get optimum results, that is best obtained by having enough treatments to completely heal and regenerate the joint complex as much as possible given the degree of damage. This ranges between about $2,500 and $6,500 plus depending on the joint involved, the level of damage, and the amounts biological regenerative solutions used. Note that a typical office doing PRP charges about $2,000 for a single session, while those doing stem cells typically charge $5,000 to $8,000 for a single session. The sessions are typically done weekly. However, they can be done closer together or further apart as needed with comparable results. In some situations where the degeneration is extensive, additional booster sessions and biologic solutions may be necessary to complete the healing process. These are done at a discounted rate for program graduates. In summary, based on my clinical and personal experiences with chronic joint pain, the best solution for most chronic joint pain is a combination of regenerative injection therapy, with or without the stronger solutions, combined with proper, comprehensive support including joint decompression, muscle balancing, shockwave therapy, light therapy, and proper nutritional support. We would like to be your go-to office for regenerative injection therapies to repair your joint issue. We also provide a variety of age reversal, performance, and appearance enhancement programs. We invite you to learn more about our innovative approaches to helping you optimize your health. Check out our website at ARTC.health, subscribe to our newsletter to receive future updates, or call us to schedule a consultation. ARTC.health, 941,806 5511, doc at ARTC.health.